Good evening, America. This is Q News Tonight, the world's first live daily LGBT evening news, and it's 7 p.m. Thursday, April 23rd, 2020. Tonight we bring you our special on Q's Q&A on coronavirus for the LGBT community. We have two special guests with us this evening. First, Donna Shalala, the former Secretary of Health and Human Services and now U.S. Representative for Florida's 27th Congressional District, appointed by Speaker Nancy Pelosi to be on the panel to manage the Treasury Department's $500 billion COVID-19 stimulus, and just voted moments ago for the nearly new $500 billion fund. We will also have tonight Dr. Howard Grossman, internal medicine specialist, very renowned, with an emphasis on HIV to answer your medical questions. Tonight on Q News Tonight. But first, we open with breaking Q News and report that the U.S. unemployment claims rate has reached 26 million, the highest since 2008's recession. Before we tell you the news on this, we've prepared a package. Watch this.
I just got laid off of my job due to the whole coronavirus pandemic.
I haven't worked in over 3 weeks.
And I really just have no idea what's going to happen next. No one does.
I was just coming like 2 o'clock into work, like they send me to HR, like they say they took my ID, like they say when they have business they're gonna call me, but I asked them like when they're gonna call me, like they don't give me any option, like they say I have to apply again. Just think about it, I'm 2 months pregnant, so I don't even know if I gonna get my job back.
Don't know if I'm going to run out of money before I can start working again. And that's been pretty stressful. Just so much uncertainty to, have to live with, while also having a lot of free time to think about it.
U.S. jobless claims reached 26 million since coronavirus hits, reported today, wiping out all gains since 2008's recession. The doors are still closed. There is still no smoke coming out of the chimneys in corporate America. It is not surprising that you continue to see significant layoffs, one of America's most famous economists said.
Another 4.4 million Americans filed for initial jobless claims last week, revealing that at least 26 million people have requested unemployment benefits since the outbreak of the coronavirus pandemic. In just 1 month, all job gains since the Great Recession have disappeared, according to new data released Thursday by the Department of Labor.
The economy had created around 22 million jobs since 2010, during a historic decade of economic expansion. That came to an abrupt end in February. David G. Blanchflower, a professor of economics at Dartmouth College, said, quote, "It is very easy with these numbers to get to 20% unemployment."
So good evening again, America, LGBT America. It's 7 p.m. Thursday, April 23rd, 2020. It's time to queer up the news. We are literally out of the closet and into the headlines. So many of your stories next on Q News Tonight. Tonight on the world's first live daily queer evening news show.
Tonight's news about the gay community and the news from an LGBTQ perspective. Are our gay stories important to you? In headlines, politics, entertainment, gay culture, travel, religion, and more. Reported by respected anchors.
Out of the closet and into the headlines on Q News Tonight. Welcome to Q News Tonight. We are live and unscripted, so we remind you anything can happen here. Tonight, we bring you the news of and a perspective from the LGBT community. I'm your anchor, Al Ferguson, and these are my co-anchors, my co-guest anchor, Misty Eyes.
Hi, I'm super excited about a new segment where a country singer does something amazing.
And anchor, Napoleon Plays.
Hi, everybody. It is International Lesbian Awareness Week. We're going to talk more about that today.
Let's cue up tonight's news. Q News Tonight is pleased to welcome the former Secretary of Health and Human Services and now U.S. Representative from Florida's 27th Congressional District. The Congresswoman Donna Shalala has just voted a short time ago for the nearly $500 billion COVID bill that overwhelmingly passed. Congresswoman Shalala, we would like to welcome you to Q News Tonight, and thank you for joining us.
You bet. Q News is such a great idea. You know, I represent Miami Beach and Coconut Grove and downtown Miami, and the LGBTQ community is huge in my district and very, very important.
Congresswoman, you represent the A in LGBTQA as an ally, and we appreciate that. We've all been to Miami Beach Pride many, many times, and White Party and winter parties, and Dade County is a major LGBT community, of course, in all of America. So again, we thank you for joining us, and we want to, what a historic moment. I hope that's the right adjective of what we're watching in COVID-19, and especially what happened today in the House and your vote. Explain to us today what you voted on and what the ramifications of what you voted on today will be.
Well, we did two things today. The first was to put more money into the Small Business Administration, particularly for smaller businesses. Unfortunately, larger businesses with deep relationships with the big banks got the first tranche of money, and we want to protect smaller businesses, minority businesses, women-owned businesses, LGBTQ members who own businesses, and they don't have as strong relationships with the big banks. So we allowed the smaller banks in, the medium-sized banks, the community banks, and our hope is the money will reach deeper. But what we're really after is paycheck protection. These are short-term loans that turn into grants that protect the payroll of these businesses and gives them some overhead to pay for electricity and other things that they have to pay for. We're trying to protect American jobs.
If I can refine that observation to make sure that LGBT America, who is watching you right now, understands, if they work for a business, this will protect that business's ability to continue in payroll so they are continued to be paid.
Exactly.
Yeah.
And that's
excellent.
That's better than unemployment insurance because it keeps their tie directly to their employer.
So in that one explanation, we can take a little bit of a sigh of relief in what you've done and what Congress has done today, because things will be more beneficial in terms of having that payroll protection.
Yes, and it's a pretty cool program because it takes care of people that are in the gig economy, consultants, so self-employed individuals can certainly apply for this money as well. Sometimes they want to apply for unemployment compensation. We've added $600 to whatever the state will pay every week for that. But there are a couple of ways that we've really put significant money in to try to protect people's paychecks. This is all about paycheck protection. And then the second piece was, of course, to give money to the hospitals and for testing. I say that because that's the speaker's line. Testing.
Yeah, we're going to talk about testing.
More testing.
Yeah, and LGBT America, we remind you, the former Secretary of HHS and Congresswoman for here in South Florida has just voted on this monumental package, and her first conversation, digital, online, of course, it's happening out for the LGBT community, and we again thank you. One of the things that was interesting to me in watching the vote just moments ago is the House was doing social isolation voting. Did that seem strange to you?
Weird.
Not the fact that you did it, but that it was going
Totally
on.
weird. We did interviews today with our masks on.
Yeah, yeah,
I
yeah.
mean, it was very strange. By the way, there were a lot of Republicans that didn't have masks on.
No surprise there.
And what does that mean?
Well, we can think about that all weekend.
Yes, I will. I'll ponder that all weekend long.
Since
Let's
you
get
have a
into
sign
your.
behind you that says unmasked.
Yes, exactly right. By the way, we're sitting in the middle of the World AIDS Museum here in Wilton Manors, Fort Lauderdale,
Oh,
and
lovely.
yeah, it's an excellent set here. I want to focus just a moment on your former job, being Secretary of HHS, but not in terms of your job, the current job. The current Secretary of HHS, I read so much, and I have seen so little from. What is going on there in terms of the leadership from Health and Human Services in this COVID crisis?
I think the problem is he's the adult in the room and they don't want adults in the room. He's a very competent lawyer who served in the Bush administration. And of course, PEPFAR was one of his babies. And uh, George Bush did just a terrific job with global AIDS. And um, Azar was Alex Azar was the general counsel during that time, so he's highly qualified. But I think in that administration, which is even with Tony Fauci and Debbie Birx are is anti, it's just anti
Science
science,
and
and of course,
health. Yeah.
yeah, and their long careers dealing with AIDS. I mean, if we would do what we did finally did with AIDS, and that is we found a treatment. We worked on prevention. We worked all over the world. We cracked down uh, people's contacts. We worked with all the populations that were affected, and we had goals, and we achieved those goals for the most part.
Your observation on the secretary being pro science, pro medical advice, it brings me right to the central question that the LGBT community is talking about just rabidly. What's going on in the White House, and why are we watching the response we're watching? And Secretary, I want to point out to you, because we're doing this remotely, your hand occasionally is moving.
Oh, sorry about that.
No problem. But the White House response, what do you think is going on? Help us understand it.
Well, I can't understand the president. He's irresponsible from my point of view and scary. He's anti science. He comes up with these strange ideas. Today it was about cleansing your body. I just made no sense at all. And but more importantly, his inability to take hold. This virus requires a hammer. Um, Not saying, well, the states can do whatever they want to do. Um, we're in a very dangerous period. If we don't bring all the testing that we need, all of the social distancing, if we're not working like crazy people to find not a vaccine, you'll remember we saved millions of lives when we found a treatment. It's cheaper to produce a pill than it is a vaccine. And we've never really solved the vaccine issue in AIDS, but we did solve the treatment issue. And then we did everything we could to make treatment accessible. So I think the end of this will be good governors putting their strategies together, but the president just it's the most irresponsible leader I've ever seen. And in a crisis, you need a strong hand, not him today. He was talking about his election.
You were a professor. If Donald Trump was your student, his grade would be so far
An F minus.
an F minus. You talked about states follow up. I have to ask you, from your perspective as a former secretary of HHS, and now in your oversight that Nancy Pelosi has asked you to participate in. Georgia reopens largely tomorrow in a state decision. What's your reaction to what you're going to see starting tomorrow in Georgia?
Oh,
Your neighbor.
I think it's very dangerous, and of course, the mayor of Atlanta and a number of the mayors have spoken out against the governor and said we're not there yet. We haven't had enough testing. We haven't reduced the number of infections in a significant way, and we don't have a treatment to save lives. So the idea of opening up and getting more people infected is more than irresponsible. It's immoral. And of course, we have a governor in Florida that can't get his story straight.
Following the White House.
Yes.
Yeah. You mentioned there the problem in Georgia about testing. Let's focus on testing for a moment. We frequently play the soundbite March 6th when the president was at the CDC, and he famously said everyone that wants a test can get the test, and implied that the test was available. 6 weeks later, we continually report that as of today, only 1.3% of Americans have been tested at all. Why is testing failing from the federal government?
I think in large part because he basically turned it over to the states and turned it over to the private sector. Um, I've been talking to the hospitals in South Florida. They all have 4 or 5 different tests that are proprietary, which means they're totally dependent on testing supplies from the companies that made those machines. The president should have invoked the Defense Production Act and taken over the production of tests, made them uniform. I pointed out to someone the other day, we made VCRs uniform. There's no reason why the purchasing power of the federal government shouldn't have been used to purchase both ventilators and testing supplies and the machines for testing, as well as the PPP. That's a federal responsibility. Right now, it's the Wild West out there. Every hospital is competing against every other hospital to get supplies. Every state is competing against every other state. That doesn't have to happen. The president has the powers, and the purchasing ability will give him all the money he needs. The purchasing ability to cut good deals and make all of this much more uniform, which would get us to a testing level and to a treatment level that we need before we reopen the government, the government
Congresswoman,
and the economy.
help us understand why he's not doing that. Why, your observation, why isn't he doing it?
I think he's passing the buck. I think he basically is not a strong leader, even though people that voted for him thought he'd be a strong leader. I think he doesn't want to take ownership of this. He doesn't understand it, and he just got to the point after he announced that he was a king that he would let the princes in the state just run the thing. And yes, they have to do the strategy, but the federal government has to set the scientific standards for that strategy and purchase all of the supplies for that strategy and then fund the strategy. He doesn't have to do
Well,
everything because the states clearly have authority. But
your
boy, there are
summary
some things that only the feds can do.
Your summary there seems a little dark and grim to me. So the question is, as it relates to testing, with these problems that we have seen since his March 6th statement, what do you project is going to happen, let's say over the next 30 days, 60 days, in terms of testing? What do you anticipate is going to happen?
I anticipate there's going to be more testing, but here's who we have to test. We're not testing everybody in hospitals yet. We're testing those that would be susceptible to getting the disease or have had symptoms for the disease. We need to test every police officer, every first responder, every firefighter, we've got to test everyone in the hospitals. And before the kids go back to school, we're going to have some kind of a testing regime for the teachers and perhaps even for the kids. But it's got to be safe, um, and and we've got to save seniors in nursing homes. This is a petri dish. We've seen it in Florida. We've seen it all over the country. But it's testing, 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 and then following through. We learned that in AIDS. We hadn't had widespread testing. We would have never been able to identify um, people who were positive that needed treatment, or their partners.
We are going to report, we're going to talk about AIDS. Today is actually the anniversary of identifying the virus in 1984, and we're going to talk about that a little later in Q News tonight. One of the things that I wanted to ask you about as it relates to the point that you just made of what happened in AIDS, not since the AIDS pandemic has the LGBTQ community been so fearful. We hear it left and right here at Q News tonight. In your district, you have a gigantic LGBTQ community. Have you had any unique challenges in your district in the gay community facing the pandemic, or anything that you see needs to be done in the LGBT community while pandemic is happening?
Well, as we've looked at this pandemic, we've seen big gaps in the healthcare system. And while we may have, um, and for every community, but particularly for minority communities and for vulnerable communities, the truth is, AIDS is HIV is an underlying condition. So you want to pay particular attention um, to people that have infections when you're dealing with something like this virus. Very close attention, making sure they have very good, that they get tested, and that they have very good health care and a healthcare system to go into. So I am always worried about vulnerable populations.
Yes, including the LGBT community. We're going to report tonight when we get into coronavirus news, when we finish with you, Congresswoman, reporting that Trump says that the virus may be gone by the fall and it might disappear, and Fauci's direct contradiction today to say there's basically no way the virus is going to be gone by this fall. The question here relates to how does the gay community and the LGBT community deal with the contradictions that are going on in truth? Who do we listen to? Who do we believe? How do we make the right decisions based on all of the misinformation that's going on?
You know, that's an easy question, because up there on the stage is Tony Fauci, who was a fierce advocate for the community, and Deborah Birx, who has been running PEPFAR for almost her whole career. So you have two people who have worked with the LGBTQ community their entire careers. Trust them.
That's where we should turn then.
Yes, absolutely.
All right. I want to ask you a political question. It's breaking news tonight that Elizabeth Warren's brother, Don Reed Herring, has passed away of COVID-19. I'm going to put you right on the spot. What do you think about Warren being announced by Joe Biden as his vice president pick right in the midst of this pandemic and this issue? Do you think that's a good idea?
I think I applaud Joe Biden's decision to appoint a woman. Elizabeth Warren, Amy Klobuchar, they're all friends of mine, so I would not want to pick between them. Kamala Harris.
So I couldn't put you quite
I know
enough
them
on the
all.
spot.
In fact, I talked to Elizabeth Warren at some length yesterday. I'm so sad about her brother, but she wanted to talk to me about the oversight responsibilities my new oversight responsibilities, and I knew that her brother was very ill, and I just feel so badly. So many of us are losing friends to this virus.
Yeah. Yeah. One of the things also is that's very confusing in the LGBT community is the process of mask and how communities have don't have a mask, then have a mask, and come back to you could be infected with a mask, and now everybody outside should have a mask. We last night went back and played Donald Trump's answer at the commission White House briefing that he wasn't going to wear a mask and showed how Melania contradicted that in a PSA. What do you think about what the president has been saying about masks, and what is your recommendation in terms of what should be happening with
Well, I
masks?
think when we go out, we have to wear masks. We're protecting ourselves, we're protecting others, and I hope everybody's wearing a mask as they're going outside. Obviously, in their own homes, they don't need to. And I really think there are only a handful of things that those of us that aren't doctors can do about this virus. We can wash our hands, we can practice social distancing, we can stay home as much as possible. If we can telework from home, and we can wear masks when we have to go out. That this virus will be curbed in part by our personal behavior. And I think we have a personal responsibility not only to protect ourselves, but to protect those around us. And no one knows that better than the community.
I want to ask you, of course, you're a professor. I want to ask you to be historian for a moment. What would have been your response if Bill Clinton had acted the way that we are currently watching our president act towards the pandemic while you were the secretary of HHS? What would your response have been to the president?
Well, I think that as soon as I saw what was breaking in China, I would have had the CDC people there immediately. Unfortunately, this administration had already cut the budget of CDC, and they had withdrawn the embedded epidemiologists that were in China that worked for the CDC. That would not have happened under my watch. The second thing I would have done is I would have gone to see the president. They tried to tell the president. The one thing about Bill Clinton, I would have marched directly into his office, and let me assure you, he would have listened. But I probably, knowing my relationship with him, would have taken Tony Fauci with me. And Bill Clinton loved Tony Fauci and had great respect for him as well as for the director of the National Institutes of Health, Harold Varmus, who was a Nobel laureate. I would have taken them in to the president's office and had the get the president to sit down, and we would have spent an hour or two explaining to him what the implications were and what we thought we needed to do immediately. I would not have been so meek as so many people were in the White House about this when they really knew that something was happening in China, but they had so weakened uh, the infrastructure in the White House, at CDC, and at HHS that that there was just no way to do that. And no one, apparently, unless you're a member of his family, you don't march into the president's office. I never let people stop me when we wanted to. Now, AIDS was an issue because Bill Clinton had friends who had died from AIDS, so he wanted to move that on that immediately. But on the tobacco issue, White House staff tried to stop us. We had evidence that the tobacco companies were targeting children, and we went in to see the president and the vice president at the same time, and they said, "Go get them."
I want to
But
ask you
you
one.
can't have these jobs. You can't have these jobs and not have the courage to speak the truth to power.
I want to ask you one final personal question. I understand your father sold real estate. Is that correct?
He did, but he owned a
Um,
small grocery store before that.
okay, well, it makes me curious with your seat in terms of what you've done. Who was the better business person, your father or Donald Trump?
Oh my God, my father. My father, because even when he didn't have money himself and his grocery store was failing, He always paid his workers. And he took care of people. And my father went bankrupt, by the way, and he spent the next 5 years paying off all the people he had debts to when he went into real estate. That's the kind of integrity that he had. But the big stores came in, and small grocers like my father were put out of business. But when he passed away, people showed up that we didn't even know, that told stories about him making sure that they stayed on the payroll, that he found them jobs, but more importantly, all the people he owed money to, all of his suppliers, showed up for his funeral and told stories about how it took years, but he paid them back with interest.
What an incredible correlation to you talking about your father and what he did and where we are absolutely tonight in what you voted for, which is to make sure businesses stay in business so they can pay their employees. It's a beautiful story. Congressman Shalala, I have such trouble with your name, by the way. I'm probably not the first person on the...
Well, in Spanish, they call Shalala.
Shalala. Okay, well, that would be a little easier for me. We thank you very much. Former Secretary of HHF, a mammoth ally to the LGBT community. The proof of that, especially in District 27, here in South Florida, is this monumental vote that has taken place just a little while ago. And the first thing that the Congresswoman does is speak to the LGBT community at Q News tonight. We thank you very much for the time to be able to do that. And
Great.
we look
I'd
forward
love
to
come
talking
back
to you
sometime.
again. Yes, absolutely. Thank you very much. We appreciate it.
You're welcome.
Q News Tonight is part of the Happening Out television network. We are the world's most popular digital news and entertainment channel.
We have more than 500,000 watch every week in Facebook television. It's a talk show like television's The View with a whole lot of gay people.
Our website is Happening Out, and it is now Florida's largest daily traffic rank of any LGBT media, pride, gay business, or gay organization by a factor of 100 times greater. In fact, as of today, on April 23rd, our website has grown in Alexa daily web traffic rank to number 15,824. It's that level of a website in the entire world, and we are committed to you.
We are Q News Tonight, the world's only live daily LGBTQ evening news with more than 100,000 YouTube viewers a week. We are the Daily News.
We are also Happening.Fun, South Florida's most popular entertainment show for concerts, festivals, parties, and things to fun, with more than 20,000 Facebook viewers a week.
And our LGBTQ television network supports the live broadcast of Sunshine Cathedral, the world's most popular LGBTQ religious broadcast.
We are your #1 source of news and entertainment during this crisis and continue to grow. Thank you for your support.
During the COVID-19 crisis, Q News Tonight will bring you today's bullet points on coronavirus, the most important news of the day that we call Corona Quickies. Here are the headlines for Thursday, April 23rd, 2020. Quarantine Quickies, the coronavirus facts for Thursday, April 23rd, 2020. First, we report COVID-19 cases. The world today has 2,700,000 plus cases. The U.S. today has 860,000 plus cases. The U.S. is just 4.4% of the world's population, but now the USA accounts for an unbelievable 31.8% of the world's cases of COVID-19. Unfortunately, that percentage grew higher today. We also report COVID facts of COVID-19 deaths. The world today has 188,000 plus deaths. The U.S. today has 49,000 plus deaths. The U.S., again, is just 4.4% of the world's population, but an incredible 26% of all the world's deaths of COVID-19. Unfortunately, that percentage also grew higher today. we want to show you a video of President Trump of what he told America at the CDC on March 6th. Watch this.
Importantly, anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test.
At Q News tonight, we hold the president to the #1 standard of coming out of pandemic, testing. As you just heard from the former Secretary of HHS. Testing results. Today, we have 4,382,000 tests completed. Trump says that's the most tests of any country in the world. It's true. It's also a misdirection lie. For 328 million Americans, and in 113 days since pandemic began, only 1.3% of Americans have been tested. Mr. Trump, that's not anyone. And the medical community recommends testing levels at 10% to manage reopening. Q News tonight, grade on Trump's testing as of April 23, coincidentally, agrees with the former Secretary of HHS, F-. Congratulations to the top states in testing, and try to work to get to 10% before you reopen your state. Number 3, Louisiana. Number 2, New York. And number 1, the most testing in any state in America, Rhode Island, at 4.2%. Next, we show you the states in the testing Hall of Shame. LGBTQ America, we hope you don't live in one of these states because the testing percentages are so terrible for their populations. Number 5, Texas. Number 4, Virginia. Number 3, California. Number 2, Kansas. And again, number 1, poor Puerto Rico, which is only tested 0.34% of population.
Quarantine quickies. The pandemic could mean 260 million people worldwide are marching toward starvation. The United Nations World Food Program warned this week that as a result of the novel coronavirus pandemic, the number of people facing food crisis could double to 260 million worldwide. The organization said that, quote, the effects of coronavirus will be a double hit on the planet. First, those in crisis need will dramatically increase because of loss of services, jobs, money, and therefore food. Second, the food distribution systems will be dramatically impacted in production. The two threats will increase the number in the most significant food-starved regions of the world, leading to worldwide famine.
Quarantine quickies. Top health official says he was ousted for pushing back on Trump's game-changer drug. Dr. Rick Bright, a top official at the Department of Health and Human Services, says he was ousted from his job this week for pushing back on demands that he sign off on a coronavirus treatment the president had advocated. Quote, I believe this transfer was in response to my insistence that the government invest the billions of dollars allocated by Congress to address the COVID-19 pandemic into safe and scientifically vetted solutions and not in drugs, vaccines, and other technologies that lack scientific merit. I am speaking out because to combat this deadly virus, science, not politics, not cronyisms, has to lead the way. Specifically, and contrary to misguided directives, I limited the broad use of chloroquine and hydroxychloroquine promoted by the administrative as a panacea, but which clearly lacks scientific merit. While I am prepared to look at all options and to think outside the box for effective treatments, I rightly resisted efforts to provide an unproven drug to demand to the American public. His comments have been a major concern to the president and the White House's response to scientific and medical recommendations.
Quarantine quickies. The Las Vegas mayor has trouble answering Anderson Cooper about reopening. We've prepared a package on this. Watch this exchange.
What are you doing as mayor to improve contact tracing and testing in Las Vegas?
Well, first of all, as someone who's pretty sure she possibly had it in January, I have already been into the hospital to say,
Right.
take my plasma.
Well,
And
I'm not talking about you. I'm talking about what are you doing as mayor
and
to
I
improve
am
contact tracing?
I'm calling upon everyone to go ahead, if they're positive, to go ahead and see if they can help being part of the preventive or the treatment pool that will have this plasma available.
Are you doing anything on testing and contact tracing? Because in order to open businesses, every scientist says that is essential.
I don't have that. Well, no, that's for our scientists, and the whole thing is fact, truth,
but you're
validated data.
Right. Fact. You're calling for businesses to reopen. Every scientist and person who looks at this says what we really need to do that is more testing and more contact tracing.
That can't work. We're not getting the truth. And I know over the years, going back to the 1950s with the atomic bomb, don't worry about it when we're testing in Nevada.
Well, as you just heard, Anderson Cooper presses the Las Vegas mayor over her wish to reopen. Las Vegas Mayor Carolyn Goodman says that she wants to reopen the city's casinos, restaurants, and entertainment venues for business so people can get back to work. CNN's Anderson Cooper asked her if that's safe given the data about COVID-19's pandemic.
Quarantine quickies. Federal relief leaves out DACA students. The U.S. Department of Education said federal financing for relief of the coronavirus for higher education is meant for U.S. citizens, prompting protests from students enrolled in colleges and universities under the Deferred Action for Childhood Arrivals program, or DACA. DACA students brought to the U.S. illegally as children do not qualify for emergency aid, Education Department officials said April 21st, the same day U.S. Secretary of Education Betsy DeVos announced an additional $6.2 billion in federal funds to higher education institutions. Higher education institutions had received $6 billion in previous funding to help them following the pandemic. The decision will affect approximately 700,000 beneficiaries of the DACA program.
Quarantine quickies. Georgia Rep. Collins sides with Trump in slamming Georgia governor's plan to reopen. Today, Georgia Rep. Doug Collins criticized Governor Brian Kemp's aggressive plan to reopen their state's economy. According to Kemp accusing Kemp of not communicating clearly amid the coronavirus outbreak and failing to solicit input from local leaders. The GOP congressman's harsh assessment represented a rebuke of his Republican governor and signaled Collins' intention to instead side with President Trump. Trump, who disavowed Kemp's plan Wednesday after previously expressing support for states reopening for business. Collins told Fox News and Friends, quote, "The president wants the country to open. I want the country to open. The governor wants the country to open. The problem is, how do you do it? And I think that problem lies with leadership. Tomorrow, Georgia begins to widely reopen."
Quarantine quickies. Trump claims that coronavirus may not come back at all, is at odds with his advisors. President Trump on Wednesday said the coronavirus, quote, may not come back at all, a claim that is at odds with his own public health experts, who have told the country to be prepared for another wave of the virus in the fall and the winter. And if it does come back, Mr. Trump claimed it, quote, will be coming back in smaller doses than then we can contain it. The president made the remarks during the coronavirus task force briefing at the White House on Wednesday. Many health experts have responded today to the president's remarks in relation to his management of the crisis of the COVID-19 pandemic. Without a vaccine, we will be active with the virus throughout 2020. Vice President Pence, director of the White House Coronavirus Commission, did not comment on the president's statement. So that is our segment of the LGBTQ community's Corona Quarantine Quickies for Thursday, April 23rd, 2020. You can count on Q News Tonight to give you the facts of the pandemic. After bringing you the quickies in the news, we're going to follow the headlines with a segment we call Coronavirus Good News. With COVID-19, we all can use some good news. We report on the best of America and the world while in pandemic. We call the segment Coronavirus Good News for Thursday, April 23rd, 2020.
Coronavirus Good News. 2 nurses take time from COVID-19 fight to get married. A pair of ER nurses at Queens Medical Center were to be getting married last Friday, April 17th. The couple had been together for 4 years and been planning the wedding for more than 2. Instead, they chose to be responsible, thinking of their 200 guests and the lives they could be putting at risk. They knew they had a bigger message to send. On what was to be their special day, the couple instead posted a picture, fully dressed in scrubs and PPE, which said, quote, "We were supposed to get married today, but instead we went to work for you. Stay home for us." Fortunately, they had what they described as a faux wedding video chat with 20 family and friends who got the cake and decorations to make the day special. Quote, "People were loud. People got drunk. It was like a real wedding party. We even cut the cake. It's going to be hard to top that."
Coronavirus good news. Blake Shelton donates $150,000 to feed the homeless in Oklahoma. Blake Shelton is pitching in to help ensure that Oklahoma families struggling through COVID-19 pandemic get enough food to eat. This week, the country's superstar revealed he plans to donate $150,000 to Give from Home Day fundraiser, a partnership between Oklahoma City ABC affiliate news stations. Blake said in a video message, quote, "A lot of Oklahomans are going to bed hungry tonight. That's not something I can live with. That's why I'm going to be donating to the regional food bank, the Oklahoma Food Bank." And yes, that is coronavirus good news. Watch this.
Hey everybody, Blake Shelton here. You know, a lot of Oklahomans are going to be going to bed hungry tonight, and that's not something that I can live with, and that's why I'm going to be donating to my regional food bank and the Oklahoma Food Bank. And I hope you'll join me in Help from Home and send in that donation, because a lot of people out there are counting on us.
It may feel that the world is in crisis, and that means now is the time to come together. The LGBTQ community must come together.
Are LGBTQ voices important to you? Can the news of the world have a gay community perspective?
If you, like us, think the answer is a resounding yes, then like and subscribe to Q News Tonight on Facebook and YouTube.
Do our gay cultural stories impact you, your friends, and family?
Start a watch party. Get your circle involved in our conversation as it supports the gay community. We are going to move on to our special Thursday night segment called Q's Q&A. We remind you that Q News Tonight has created a special Facebook group called LGBTQ+ Coronavirus Facts. You can find it here. We're going to show you the Facebook page. The group is moderated by infectious disease specialists, mental health specialists, medical experts, social service providers. It has recommendations on how to spend your time.
We even enlisted spiritual leaders, all there to help you through this crisis. Be sure to join the group and ask all the questions you like.
This is part 6. 6 weeks we've been doing this of Q's Q&A on coronavirus and the LGBT community for April 23rd. This special segment is designed to be unique in America to answer your questions about coronavirus with a specific lean to the LGBT community during this pandemic. Tonight we have an American pioneer in AIDS HIV medical treatment. With us tonight is Dr. Howard Grossman, specialist in internal medicine with an emphasis on HIV. He had a practice in Manhattan, which was one of the largest HIV practices in New York. He has become nationally recognized as an educator on HIV issues and as an advocate for the LGBT civil rights and the rights of our community. Welcome, Dr. Grossman. And before we get into our viewer questions again this week, another big week from the science and medical community, where would you like to start? Anything that you would like to tell us in bullet point about COVID-19 and the pandemic?
Well, first I want to thank Q News for inviting me back again for Coronavirus Thursday.
Is that what we're calling it now? Coronavirus Thursday.
Coronavirus every day on this planet.
It's true. It's true. I mean, I will reverse your pattern, and let's start with two pieces of one piece of bad news, but not unexpected, and that is the fact that hydroxychloroquine has now been found to not work, and in fact, in a VA study, large VA study here in this country, was found to have an increased death rate compared to regular treatment. So the president's favorite drug turns out to not work at all. In fact, and our government has wasted a huge amount of money buying up pills, probably from a company that he has interest in. The secretary or the head of vaccine research, who you mentioned got transferred suddenly, was absolutely right.
To be clear about that, it's because it can cause heart arrhythmia in people that don't need the
that's
drug,
just
correct? Or are there many other reasons?
Yes,
that's what I've been
just
reading.
one of the side effects of the drug, especially in very ill people.
Well, we can finally put that story to rest once and for all. And you started on some bad news.
So the medium news that we're not sure what to do with was a Chinese study that was published today on remdesivir, which is the antiviral drug from Gilead that's been talked about, and they said it did not work in their patients. Now, this was a study that did not enroll completely. The company put out a press release saying, we don't know what to do with this study because it didn't reach any level of significance, but people were disappointed in it. At the same time this week, we heard from the group in Chicago, at the University of Chicago, that they treated 125 people as part of a much larger group. I think there's 150 sites around the world. And they said all but 2 patients died. All the other patients left the hospital okay. Now, that data on the first cut of that very large study is supposed to be the end of this week or next week, by the end of the month. And so we should know more about remdesivir then.
And so we've got bad news, neutral news, medium news.
And the good news is that actually antibody testing is now widely available. LabCorp announced a home test. I'm not sure yet if that is actually out there and available, but Quest announced that they are doing antibody testing in the lab. So any doctor can now order antibody testing. Now, I will give the viewers a caveat. We're not sure what a positive antibody level means, other than that you've been exposed to the virus. We don't know if antibodies are protective yet. I sure hope they are, since I have them. But there's no reason to think that they're not either. But we're not sure about this yet. I think the biggest reason to test for antibodies is to know what the prevalence of this virus is in the community. How many people have encountered this virus? How many people have developed an antibody response, so that we kind of can trace where these things are.
I'm curious, is your medical opinion, I'm reading this, I'm watching it over and over again, that we're really cycling down to our number one problem, which is our lack of testing, and therefore it leads to our lack of decision making.
Testing and contact tracing. And as Laurie Garrett, who's a Pulitzer Prize winning writer and a student and author about epidemics, has repeatedly said lately, we need smart testing. We are never going to test all 300 million people in the US on a regular basis. Plus, you could be negative today. Now, this is not the antibody test, but the PCR test, the tests for infection. You could be negative today and get infected tomorrow on the subway. So how do we continuously test people?
Right.
So she's talking about what she calls smart testing, and I don't know all the details of it, but Laurie Garrett is brilliant. And it's targeted testing.
Before we jump into viewer questions, I want to, for America's benefit, understand, in full disclosure, first off, we're practicing social distancing here on the set at Q News tonight, here at the World AIDS Museum here in Wilton Manors, Fort Lauderdale, Florida. And Dr. Grossman had COVID and has recovered from having COVID-19. You tested positive.
Never had symptoms.
And never, right, you were asymptomatic.
I just
through
happened
the
to do
entire
a test
process.
by myself.
But are still distanced appropriately.
Right.
Yes, exactly.
But I now have antibodies, and my virus test is negative.
Yeah, exactly. And we wanted to make sure America. Well, first, if for no other reason, there's hope.
Yes,
There is
exactly.
hope going on. Let's jump into our questions. A viewer asked, we are around 50,000 deaths approaching that in the United States now for COVID-19. Just as a human and a doctor, Dr. Grossman, how does that grim statistic land on you?
You start off with a gut punch, don't you?
Yeah.
This is a disaster. I mean, this is in 2 months. In 2 months, we have as many deaths as we had in a decade in Vietnam. I mean, put that in perspective. This is devastating. And, you know, for each person, for each family, it's a very personal thing in the person they lost. So I'd just like to take a second to mention somebody who died a couple of days ago, and her name was Eileen Mitzman, and she was an AIDS warrior. She and her husband lost their daughter to HIV early in the epidemic. Her daughter was going out with a bartender from Studio 54 and became infected. They started Concerned Parents for AIDS Research. That was a big supporter of AMFAR and many other organizations. Eileen and Neil were amazing people, and Eileen, the best way, she was a little tiny Jewish woman from Brooklyn whose father was a bookie, and she was fierce, and her voice was gravelly and came into the room before her. And the best story I ever knew, I mean, those of you who remember Jesse Helms, who was the darkest splotch on the floor of the Senate in our lifetime, and the most evil person before Mitch McConnell, she got into an elevator in the Senate office building, this little woman, and she backed him up against the wall of the elevator and was poking him in the chest, telling him about what he needed to do to fight HIV. When that door opened, he went scurrying down the hall as fast as he could, and that was Eileen. She was amazing, and she died from the virus.
What thank you for telling that story, and what a beautiful tribute to everyone that followed followed her in what you just did.
So much
Napoleon, you have another?
Well, yeah, I want to comment though, that, I mean, 50,000 deaths, that's just 1/4 of what we projected as the worst case scenario. It's terrible because in my head, I start playing this as, oh, we're 1/4 of the way there. And that's not even true. Not only are we playing with deaths, am I playing with deaths while I'm saying that, but we're probably going to exceed 200,000. That's not a medical opinion, that's just my personal opinion, and we're 1/4 of the way there. It's disgusting.
I think the viewer question of using the word grim is a reflection of what you just said. Are we just becoming numb to the numbers? Dr. Grossman allows us the opportunity to personalize a person, but there's 50,000 of those stories.
And families.
The vets are showing us that.
And people are dying alone without anybody to be holding them, holding their hand, talking to them because they're in isolation.
Elizabeth Warren's comment today about her brother, that was her #1 observation. Her brother passes with no one being able to be present.
Right, and that's happening everywhere.
This
and
is a
remember,
tragic story.
we just passed the top of the curve. Okay, we've got a long way down to where this is under better control.
Yeah.
Napoleon, continue with a viewer question.
The next viewer question is, what is the #1 thing to help prevent getting this disease that you don't hear talked about enough in media?
You know, I think the #1 thing is social distancing more than anything else, and being smart about things. You know, you don't have to wear I don't think you have to wear that mask out in the street. I mean, unless you're in crowds. But you are in crowds in the supermarket. You are in a crowded box in the pharmacy. So put your mask on. Because those are small spaces. I think those are the most important things. And find activities to make your life socially distant better. It's really important. We're going to talk about mental health, but it's really important that people realize this is going to go on for a while. And you need to find ways to normalize it. You know, the romantic thing of being stuck in with your family lasts a week, and then you're at each other's throats. And think of people in tiny apartments. I mean, 1-bedroom apartments in New York with a whole family.
Sanity is very important.
Yes.
I have a viewer question. Do you agree with Dr. Fauci that this illness is likely to be around for most of the year?
This illness is going to be around for a lot more than this year. This illness will be around until we have a vaccine. What the concern is that you hear and you spoke about with the Congresswoman is the idea that this will take off again in the fall. But really, it has nothing to do with the cold and what Donald Trump talks about. It's that we're bending that curve, and the curve is going down, and we're going to get to a place where we get to a point where we release social isolation, and that's going to be in July and August. So September, October, November is when we can see a rise again, and the fear is that it's going to happen at the same time that we see a rise in flu. And flu, remember, the most sick people are the same. Are the elderly, the people who are immunocompromised, and babies. We don't really see COVID-19 in babies, but we certainly see it in the other groups. And those things fill the hospital as it is. So I would encourage everybody this year to plan on getting the flu vaccine. The flu vaccine comes out in August. I give it in August, September, and nobody gets sick. It's very interesting. But you give it in November, December, when everybody's getting a cold anyway, and they say, oh, it was the flu vaccine, I got a cold. In August, September, nobody gets sick. Yeah. So get that vaccine early.
Yeah, I think Bill Gates was saying something similarly.
Yes.
Another viewer question. What should people do if they continue to experience difficulty breathing after their fever breaks and other symptoms dissipate?
Get to the hospital. That's as simple as it gets. You hear the public service things, they say, call your doctor and do a telemedicine visit. Don't call your doctor. Go to the emergency room where they know how to handle it.
Unfortunately,
people are scared to go right now, so it's how it happens.
And
if you're not breathing.
In just this little 15-second exchange, the misinformation that is starting at White House Corona briefings daily start right at the top, and they continue of misinformation. Mm-hmm. And so when you say, well, that's incredibly obvious, 8 out of 10 people, they go, but I heard, or I heard, or I heard, and we create
Call your doctor.
What
am I going to do for you if you're short of breath in the middle of the night? You have to go to the emergency room where they can give you oxygen.
And we get into fears later.
Another viewer question. As April comes to a close, state leaders are becoming anxious to reopen their local economies, and liberation protests are springing up across this country. What are your thoughts on the efforts to get the economy back up and going? And are there any precautions that local leaders should keep in mind as they make these difficult decisions?
Okay, multiple questions. First of all, everybody knows how devastating this is to people, that people do not have extra money, that people live from paycheck to paycheck. I think we need to change that when this is over and help people save money again, as they once did. But so it's a disaster, but it's better than dying. Mm-hmm. And, being thrifty is a whole lot better than being dead. So I think, most of these efforts with these liberation movements are what they call astroturf. They're being funded by right-wing, gun-crazy people, and the same people who funded the Tea Party that's done so much destructive things to this country. The same people are behind those demonstrations. But of course, they're attracting more people because people are desperate. So truthfully, I think that these people are crazy. And we should see Darwinism at work anytime now, because those people aren't social distancing, and they're probably going to get sick. There was another story today of some guy who said that this was all a scam. He's dead of coronavirus. We see these stories constantly. What do we do to get the economy back up? Testing and contact tracing. So it's not just testing, but it's figuring out who people might have exposed, and getting to those people before they get sick.
It's interesting. The number one shocking thing of these protests, by the way, 60+% of Americans think that the social isolation strategy is absolutely at polar opposition to the demonstrations, the smaller demonstrations that we're seeing in some capital cities. But it was interesting to me as I watched video this week of some of these protests, the overwhelming amount of time is large groups of people that were doing this protest. And when I say large groups, 300, 400, 500 people nobody wearing masks
No
and standing right on top of each other. And I wondered, well, I wonder how long it's going to be before you have COVID-19.
But they're not endangering themselves. They're gambling with somebody else's wallet.
Yeah, yeah, absolutely.
Exactly.
It's been shocking.
But if I can say one thing, I
Please.
think Brian Kemp is crazy in Georgia. I think, well, unless he's, remember, this is the man that disenfranchised hundreds of thousands of black voters in order to win his election by a very small amount. What's your biggest city in Georgia? Atlanta. What's with Atlanta? It's a majority black city. Is he trying to kill off the black population in Georgia by reopening the whole state? Are beauty parlors and bowling alleys really essential services? I think there's something else going on here, truthfully, but I don't know. Like the Trump president says, I don't know. It could be. Right. Who knows?
A viewer, Dr. Grossman, a viewer asked, essential workers like grocery staff and postal carriers are increasingly being exposed to contracting COVID-19. Are companies' no contact and distancing measures enough to prevent the spread if we go into grocery stores, et cetera, or is it too little, too late?
No, I think they've helped. But there are these are some essential things. I mean, frankly, I think that in grocery stores we could order online and pick and arrange for a pickup time outside the grocery store and drive our car up and get our groceries loaded into the trunk and avoid that exposure. It would give people new jobs. If people don't have a computer at home, they could go to a kiosk in front of the market but not go in the market. All of that would protect people more. The post office, the post office workers work on top of each other in sorting rooms and things like that. So I'm not sure how you could do more. Medical workers are at risk because they have to work. So I think some of us are going to be at increased risk no matter what. But I do think that these measures help.
Yeah, there's definitely things like that I was telling my mom, who is in the vulnerable category, just to make sure that she gets those deliveries. Moving on, a viewer asks, improving access to mental health care is an important goal of LGBTQ+ efforts. How is COVID affecting access to quality mental health care and psychiatric outcomes, especially for high-risk LGBTQ youth?
Well, a lot of mental health service has gone virtual for those providers that can do that. And fortunately, most young people are adept at using virtual tools. I think it's very hard for older people. And there are some providers that can't do it. So I think it's very mixed, and we need mental health services more than ever. Here in Florida, every county has a mental health line for people to call, and they should call that line to get help if they want. We refer many people to the place Misty works, which is SunServe, so I would turn to her and ask her what's going on there to address this.
Yeah, sure. As you mentioned, I do work at SunServe. I'm the director of transgender services, and we were originated as a mental health organization and still primarily mental health led and focused. Right now, you're correct. We do have 3 youth groups, and the youth groups are working full force. Might have heard rumor today that there's a waiting list now because everyone's working at maximum capacity. I think that's the national code for nonprofit, but everyone's working at maximum capacity right now. And yes, you're correct. We are doing teletherapy. And in my department, we're doing teletherapy and telecommunication. Our intakes are high right now. Everyone is scared. Everyone needs help. Everyone's nerves are wired. So I work all day and then I come here and work at night. My nerves are fried. But you're right. Mental health care is very important to all LGBTQ people. And SunServe is a great organization that can help you with that as well.
And all of it is seriously underfunded and has been for years and years.
You're very correct.
Misty, I know you had a viewer question that you had about being in public.
Yeah. So this viewer question is, when I need to go out in public, how should I prepare? And what is an ideal decontamination routine?
Well, I would say first we talked about the mask, and I think the masks do really help, whatever form you take it. Certainly I would hope that if people are coughing and sneezing, they're not going into public spaces. Because if they're wearing a bandana, that's not necessarily going to keep them from infecting people. But on the other side, the mask itself is going to give you some protection. So I think that that's important in the grocery store, in the pharmacy, in places where there are lots of people, at Target, at Sam's Club, places like that.
What about
Costco.
just out and about, biking, running? I know I bike a lot. We talked about this the other day, and there are people that drive with their windows down, or I'll have to pass by 45 people on my bike that is maybe 10 feet away at best. There's wind, and a lot of newer studies that we reported about last night on It's Happening Out seem to show that it does linger in the air for longer, and without a more proper mask, I could be inhaling something that somebody else is, or vice versa.
You know, I think that there is some fear there, and some of the things that I've read that say that if you're doing activity like running or biking, you should stay 15 feet apart from people. I don't think really anybody knows. Remember, as we've talked about several times, we're watching science and development, and that's not something people know how to handle. The best advice I can give people when asking these questions is listen to everybody, and the truth is somewhere in between. So, you know, if one person says it's 15 feet and another person says it's 5 feet, go 10 feet. And that's just a good way when you're hearing this information coming at you, and it seems like it's all over the place. Listen to everybody and take the middle course. That's what we learned to do with HIV. You know, you got a lot of talking heads out there. They're paid to have strong opinions. They don't really deal with the details. And so people get very confused. But this is science and development.
There is one asterisk to Dr. Grossman's observation. You heard tonight in our interview with the former Secretary of Health and Human Services that when there is no middle ground, if Donald Trump says it versus Dr. Fauci says it, you only listen to Dr. Fauci.
Exactly.
We heard that and learned that tonight.
Exactly.
Dr. Grossman, our last question tonight that we want to ask is about your expert medical opinion from the perspective of what you have done, especially in the early days of AIDS and now HIV. Are we going to be okay as a country after all of this is said and done?
Look, the U.S. is a very resilient country. We've survived many, many crises, wars, you know, other things. We've never had such a stupid president, but there is still a functioning government out there somewhere. From a medical point of view, yes, not, you know, there are still a lot of people who are going to die. There's just no question about that. Nowhere near as many as before people stood up and social distanced, because people have done in most places what they need to do. The crazies accepted. I think a lot of it's going to depend on what happens in the next few months. You get more states like Georgia that open up all kinds of personal contact business like massages where people are touching each other. And you're going to see recurrence in certain areas of the virus. The places where they take good precautions are going to do better. That's from a medical perspective. You know, from another perspective, you know, I don't think that things will be the same in any way. How will we go to the theater, for example? Well, they go 3 new shows in New York said that they're closing. Restaurants are closing, going out of business. But we are resilient people, and we will come up with new ways. Like the other day, Michael Urie performed on YouTube, Benefit for Broadway Cares, doing Buyer Seller, his show about, you know, working for Barbra Streisand. That was hysterical. That theater will come to us in new ways. Food will come to us in new ways. And, you know, and I think our country is very creative that way.
You know, interesting in your observation, I think Napoleon wants to jump in also, but interesting in your observation as you were saying how we will evolve, I immediately thought that's exactly what the virus is going to do also. It's going to continue to evolve and modify, and I guess we are going to also.
Well, so far, actually, though, there are 3 different types of the virus, but they're not significantly different. If we have a vaccine, it will work against all of them. So I'm not sure this virus is going to go, but there will be other viruses. We won't wipe those out, but hopefully we will handle them better. I think the biggest challenge is going to be to vote on November 3rd, to get rid of the people who made this worse, specifically Donald Trump. If this country moves into fascism,
what a soundbite that is.
then yes, it is the end of the U.S. But if we get rid of the fascists, if we get rid of the people who the authoritarians, if we get rid of the people who are making stupid decisions like our own governor here, then we have a chance to shine. Because look at, Congress found $2 trillion. They just pulled it out of their butt to help people. Where was that money for health care? Where was that money to house homeless people? Where was that money for everything else that we need to do in this country? Somehow it didn't exist before, and now it does. And I think that people are going to remember that.
Yeah.
Any final thoughts?
I'm ready to move into the big finish. I think that we've had a lot of information to cover tonight, and we thank you. I hope that you'll join us again. In terms of that. Yeah, there's a lot. There's so much to cover. There's so much to cover here.
I'm having fears of the Handmaid's Tale becoming reality.
Right.
Very much so.
I agree with both of your observations. Dr. Grossman, again, thank you for being at Q News tonight.
My pleasure.
We hope, we haven't asked him yet, but we're officially asking you right now. Our coronavirus Thursdays, I guess we're going to start to identify it. I honestly think this is one of the few places in all of America where we're doing question and answer that is very important, much deeper questions tonight, but specifically focusing on the LGBT community.
Oh yeah, I'm going to get your number. I want to ask you questions every other day. You're going to become my personal contact for LGBTQ information.
He could also become your personal doctor, and I can refer you to him if you want.
Right, exactly.
He's my most referred.
I love our connected community.
You take patients?
Yes.
Right
down the block.
Oh, all right.
Dr. Fantasy's coming out now.
Yeah,
it's a different show.
Right. Well, again, thank you very much, Dr. Grossman. It's been very informative, and we really appreciate it. Finally, we finished Q News tonight. Oh, and one last thing for Dr. Grossman. We very much appreciate your patience tonight. Of course, we are running long tonight, but it was a very unique opportunity to have the former Secretary of Health and Human Services, who is now responsible, selected by Nancy Pelosi, to help be on the panel to manage the Department of Treasury in the $500 billion and have voted just in the last 90 minutes on that $500 billion package. So we appreciate your patience, but of course it was super topical.
Yeah, and she's brilliant, Donna Shalala.
Especially for down here, because she was the former president of Barry University, which gives an opportunity for her to really care about students that are here and across the board. She's impressive with everything that she does, and I can't wait to hear more from her.
So we thank you again. Finally, we finished the show tonight, Q News tonight, with the big finish. These are stories that we just want to make a quick mention of, kind of lightning round. So here we go, Q News tonight, the big finish. Story number one, the big finish. Trump golf courses are seeking United Kingdom and Irish financial aid, something that was prevented in the United States, to cope with the coronavirus impact.
And if Trump can't get his self-signed checks to save the only exercise he gets outside of toilet tweeting, I don't know what hope I have to get my check in the mail. It's never coming.
I was going to say the same thing. Like, why don't you write yourself a check? I mean, it can come from somebody else, like the United States.
Love Donald, best man in the world. I'm the best.
It's my world, even in England. Whatever.
I have nothing more because I just love both of those observations.
Yeah.
The big finish. Trump's first openly gay cabinet member wants to stop sharing intelligence with countries where it's illegal to be gay.
China, meanwhile, is still under investigation for potentially holding back intelligence on coronavirus. Now, I don't know if our country has learned the word hypocrisy by now, but if we haven't, stay tuned for more tomorrow.
Yes.
We are full of hypocrisy news, and we will give them to you in leaps and flows. If I do think that we should start punishing people that are anti-LGBTQ.
It's actually a rare good idea from the White House and the Trump administration. I hope it can be accomplished and that the president doesn't cut him off at the knees like Trump has done to more than 40 major White House officials in the last 3 years. Let's review. That includes chiefs of staff, press secretaries, cabinet members, attorney generals, and the like. So good luck, dude, with this one. But I do agree with the position, mostly because the Trump administration clearly needs to keep all of the intelligence they can muster for themselves, as they've been lacking it for quite some time.
And keep the gay guy on his knees, apparently.
Absolutely. The big finish. Poland debates a law to ban sex education in their schools by labeling teachers that do it as gay activists and pedophiles.
The only part of this that makes any sense at all is that the people skilled enough to educate about sex are gay. Hashtag gays do it better. Yes, we do.
That's my same takeaway, actually. Very, very close. I'm like, what about sex education is gay, period? I mean, there is something called heterosexual sex. Straight men have sex with women, etc. That's not all sex is gay sex. So, and not people... How are teachers pedophiles?
I'm heard there's more straight people than gay people in the world, too. So the numbers, again, do not add up for our administration.
Exactly right. Hashtag straight jealousy. Just saying. It's easy to think America is the worst sometimes with all of our frustration. But I am very concerned with the situation in Poland right now. I seriously am. There is a new gay iron curtain forming in the Eastern Bloc with Poland and Russia. And it's very, very bad news for the LGBT brothers and sisters who live there.
Or from there.
We move the big finish talking about the NFL draft is tonight. That's a sport, Napoleon.
I know about playing with balls, Al, okay? And they do that professionally, but also in the news, the coronavirus.
UGLY, coronavirus, you might die, you ugly. You ugly.
It's the draft tonight, or also known this year as hot, muscled, and barely legal men getting paid millions of dollars by rich old white men to get physical with other hot and muscled men.
Ooh.
Or at least that's what COVID-19 social isolation among horny gay men think. You know, here it comes. Like Napoleon plays.
Oh yeah, it will come soon tonight.
The big finish. Happy 43rd birthday to John Cena.
Okay, I'm not the most knowledgeable regarding sex with females, but I imagine that this is the dream. Being the best paid person to fake it on camera. Congratulations, John Cena. You are incredible on camera.
I think he is everything. He's an amazing wrestler. He's an amazing body. He's an amazing man. He's an amazing actor, even in the movie Trainwrecked, where it was hilarious and a mess all at the same time. And he's one of the biggest Make-A-Wish donations. And all I have to say is, John Cena, I would like to make a wish.
Funny.
All I heard was that he's the biggest.
And he probably is. Oh, even at 43, I have no doubt he would be the most popular guy in any city in America on Grindr. I have no doubt he would be the #1 view in the world on Pornhub.
Truth.
We're gay. We daydream. It's what Napoleon does 21 hours a day.
I'm sorry, what were we talking about?
Right? But John Cena has also completed by far, as Misty says, the most Make-A-Wish request of anyone alive on this entire planet. It is, of course, easy to dismiss wrestling as super homoerotic and silly, which it is.
Drag.
But it is rare and encouraging to see someone who talks the talk of being a hero, but also is walking the walk. Many in Washington could look to John Cena's example. The big finish. On this day in 1984, the virus that causes AIDS was identified.
And we are still trying to identify what causes our new virus, coronavirus. And I didn't make a joke about this one because of all of the parallels between HIV and what we're dealing with now. If I had not had very good gay mentors in this community and beyond to tell me what it was like in the 80s and in the 90s to watch their friends die, slowly die in horrible deaths, I might not have been as well equipped to, I'm not equipped now, but even slightly equipped to deal with what's going on. It is so extremely paralleled, and both experiences being so painful. I really hope that we can get through this and find a greater level of a cure and vaccine than we were able to back in 1984.
I have to jump in really quick before I comment on this. Napoleon as a millennial is one of the best representations of commitment to safe sex and the use of condoms that I hear in the millennial community.
Thank you.
Yeah, I didn't know that, but that's awesome. I watched somebody die when I was 12 years old, wither away to a skeleton with lesions all over their body, and we didn't know what was wrong with them. And we went to the hospital every day, and when they died, we found out what it was. And my mom, they lived in our house for a while, and he was a member of our church, and we put him in our house. And my mom bleached everything, and that put a fear in me. I've super safe sex ever since I became sexually active. But as far as this virus, it gives me hope. Science is amazing, and science can figure out things. Science took HIV and AIDS and made it no longer a death sentence. And I truly hope that we are going to see the same thing happen with COVID-19.
Yeah. This is a very important anniversary, not only because of AIDS, but also because of COVID-19. For the younger members of our LGBT community, it may be hard to imagine the horror of the 1980s for those that lived it. I know so many people that died from AIDS. It cut short the life of icons like Freddie Mercury and Rock Hudson, and even the greatest science fiction writer, Isaac Asimov. He succumbed to the disease. On this day in 1984, we knew little more than anything else of just a name. That was it. It didn't matter all that much then, but it was the stepping stone to where we are now. Proof. Q News Tonight is broadcasting from our set in the middle of the World AIDS Museum. It's hallowed ground for the LGBTQ community. It's our Washington's Vietnam Memorial. Today, it's still a terrible disease, but now it's treatable. I want that to be a lesson for you tonight. Even in the darkest of times, there is always reason to hope that someday it will be better.
Yeah.
This pandemic will pass. The president will pass. Not all of us will make it, but someday we, as a community, will all be okay, and we will be remembered. Please, God, hear my prayer. Amen. That is today's news for the LGBT community on the world's first daily live LGBTQ evening news show. Remember, if it's important in the LGBT community, it's important at Q News Tonight. But you've got to help us. Click subscribe on YouTube and share this news. We are literally out of the closet and into the headlines. This is the only source of live LGBTQ news in the world. Your community needs your support. And remember, you're not alone. We are going to get through this crisis. We are here with you, and this is Q News Tonight. So thank you for joining us. I'm Al Ferguson, and on behalf of my anchor partners and friends, Misty Eyes and Napoleon Plays.
Pay attention, pub community. This was for you.
We'll see you every night at 7 p.m.